Welcome back to the Morning Blend. If you hear you have to have surgery, you hope your doctor uses the least invasive procedure possible when he operates. Today in our Well Health Medical Week, we get a first-hand look at the innovative tools being offered at Las Vegas Minimally Invasive Surgery.
That's right. Here with more is the CEO of Well Health Quality Care. It's Dr. Warren Volker. Welcome in, sir.
Good morning. Welcome back.
Glad to be here.
You brought a lot in today.
We did.
Got a little show and tell, the instruments that you use. But before we take a look at this, let's talk about the Women's Pelvic Health Center and what you offer there.
Yeah, at LVMIS, Women's Pelvic Health Center, we offer some of the biggest innovations in pelvic reconstruction, prolapse problems, urinary incontinence, any type of endometriosis problems and things like that.
You're a very busy guy. You could be doing a lot of different things, but you decided to open up this center also. Tell us why this was so important for you.
Well, my specialty is minimally invasive surgery and pelvic surgery, and that's what I do. And when there's no other option left, because there are a lot of options before surgery. In fact, when patients come to our center, we try to do everything we can to keep them out of the operating room. But when they do need surgery, the best thing is a minimally invasive surgery.
Absolutely. What makes this so unique compared to other centers you might see in town?
Well, at our center, and there are many options around the city, in our center, ours is unique because it's recognized as an international center, not only for women and for pelvic health, but also we do training there. We have accredited fellows who you'll get to meet later this week. And we're constantly doing research innovations and working with technology companies to develop new approaches.
It's really all about women and their issues.
Correct.
So you're really going after and helping us.
You're a braver man than I.
Yeah. Okay, and tell us, for people who are not familiar, what is minimally invasive surgery? What does that mean?
You know, you hear minimally invasive surgery on all kinds of specialties, and really what it is the way we do surgery. Traditional surgery is done, as you can see, there are options there, and where back in the day we used to make vertical incisions on people. That gave us the most access. And then as we started to work lower in the patient, we made horizontal large incisions, and now we can do almost every major surgery through small ports that are 5 to 10 millimeters in size.
And that is very small and can heal a lot easier, couldn't it?
Yeah, it has taken surgery that used to be inpatient, where patients were in the hospital 3 to 4 days and sometimes 2 weeks, to now same-day surgery to overnight they go home.
And can this be used for pretty much any type of surgery that women face?
It is, and you know, 11 years ago when we started doing minimally invasive hysterectomy and other major surgeries that were done open, we've evolved it, and it continues to get better.
We have show and tell. Yeah. We get robotics, and I'm a nerd. Let's take a look at some of this stuff. Sure. These are the robotics that can be used during a minimally invasive surgery, right?
Correct. Yeah. Robotics is the latest and greatest tool that we have now to perform these procedures.
And we're taking a look at some footage of it right now. Now, what's happening here? What are we taking a look at?
Yeah, and you know, for purposes of this morning, what we're showing you is how we're going to enter the abdomen. Okay. So this is a patient that's laying on a surgical table, and marks are being made to plan the surgery, because since we can't, you know, in this approach, open the whole belly. When you open the whole belly, we make an incision and fillet open the belly. Yeah. We don't really need to worry about anything as where our instruments are going to go. They're in our hands. But when you're doing it through small ports and small incisions, we strategically measure and put where our instruments are going to be. So
you need to know where you have to be without having to open the whole trunk, as it were.
Correct.
Like they do when they operate on the knee. They used to have to rip up the whole knee, but now you can just go in microscopically almost and get to the problem? Yeah,
and in orthopedics, like you said, my colleagues, they actually now do it through the same approach. They use small incisions, and every specialty is moving that way.
Now we have about 2 minutes left. This is something that's used to train surgeons, right?
This right here is what we call a pelvic trainer, and what you can see is what this simulates when we're training doctors is we can move this around. What you have here is this is actually an actual port. This is what we actually operate through.
So that's that is the item, I guess you could say, that would keep that little piece of skin open so you can get in and do what you have to do.
And this right here allows us the entry. This right here allows us, and you can see this is not sharp.
No, not at all.
This is not sharp at all. And instruments have become less traumatic, and when we put this port in, I'll show you, Dow, this comes out, and this is our port, and this is where we operate through. And what you can see is this is very small, and we can do a whole surgery through 2 or 3 or sometimes one of these.
That's pretty incredible. That's something. This is less than, it seems like about the diameter of a penny.
It's less than that, yeah. It's 10
Obviously,
millimeters.
a lot of training goes into this. So how long does it take for someone to get certified?
Well, and you know, it's evolving as we go, and in our world, OBGYNs are now being subspecially trained and certified, and in our world, there's an additional 2 years of training to become a minimally invasive accredited surgeon.
And I know that the scarring is minimal. I know that the speed is very fast. I know people from all around the country have been coming in as well to have their procedures here, around the world, really.
Exactly, exactly.
Let's talk about some of these other instruments that you brought into that you would use.
And you know what we're doing now is, it used to be like this mystique. It was really secretive and cloaked that we did surgery. And just grab that there, Dow. And this is an actual instrument. Now this one is a laparoscopic instrument that we use. And what you can see, and as we're showing you when we're training, this is the instrument that would go through when we're actually doing surgery. Now this one here is handheld. Wow. So this is a laparoscopic approach. And I can show you robotic if you want to see that as well.
We have literally 15 seconds left.
Yep. And so the same principle, but the robot holds this instrument.
That is
so
amazing.
You can see. Yeah.
Wow, that's brilliant.
Yeah, and this is all the different tools we have.
It's a total pleasure, Doctor.
Thank you so much.
Really incredible technology.
For more information on LVMIS, just head to the website or call the number on your screen tomorrow. See how to really talk to your gynecologist, and we will be right back.